Good morning, good afternoon, good evening. Let us know which one of those applies to you by putting in where you're joining us from in the chat. My name is Carmit Keddem, and I'm the Deputy Director of JSI's Center for Health Logistics. And I'm really delighted to have you join us for this second in a series of Facebook Lives focused on supply chain best practices. And this conversation is going to be focused on client-centered supply chains. At JSI, we're committed to putting the client at the center of the supply chain rather than at the end, and being cognizant of the client's wants, needs, and experiences. So today I'm joined by JSI and InSupply colleagues and friends who bring a wealth of experience in this area, and I'm really excited for this conversation and looking forward to hearing from them. So let me do a quick round of introductions before we get started. First, we have Phillip Kamutenga, who is currently JSI's Deputy Director of the USAID-funded Global Health Supply Chain Project in Tanzania. Phil has a really impressive background in both the public health supply chain strengthening space as well as in private sector logistics. And he's led teams in Malawi, Uganda, Zimbabwe before he joined us in Tanzania. Phil is also a leadership coach. Next, we have Mika Bwembya, who is JSI's Supply Chain Director of the USAID Discover Health Project in Zambia. She works with Ministry of Health and other stakeholders to expand family planning services through the private sector using a total market approach. Mika brings extensive public and private sector experience in ensuring an uninterrupted supply of health products. Welcome, Mika. And last, but certainly not least, is Laura Nabwire, who is the Kenya practice lead of InSupply Health. InSupply Health is a health advisory firm in East Africa affiliated with JSI Research and Training, and it's their mission to transform lives by co-creating innovative and sustainable solutions for healthy communities. Laura brings extensive experience in supply chain management and commercial operations leadership, both in the pharmaceutical and consumer healthcare space. Thank you all for joining me for this conversation, and it's lovely to see your faces since we don't get to interact live very much anymore in these COVID times. And with those introductions, let's get started. I'm going to go around and ask each of you a question, and hopefully we'll have enough time to come around for a second round. So let's get started with you, Phil, on this subject of client-centered health supply chains. Who are our clients in our client-centered health supply chains?
Thanks, Carmit, and good morning, good afternoon, everybody. So when we talk of client-centered supply chain, the primary client we're talking about is the men and women and the children who visit every health facility every single day seeking for life-saving medicines. That's our primary client. But for them to get those medicines, obviously, there are several other layers of people and institutions that support making sure that there are medicines. We're looking at program managers. We're looking at health facilitators, providers. We're looking at sponsors. So those are secondary, but the primary is those men and women and children who visit the facility.
Great. Thanks for making that distinction, Phil, around the primary clients and also other clients in the supply chain as well. Mika, would love to hear from your perspective why it's important to consider the client in the health supply chain.
Thanks, Carmit, and thanks for that question. A supply chain, a health supply chain system in any setting is centered around a client. And this is because a client determines what services or product you provide, as well as how and where you offer it. So as we heard earlier from Phil, the primary client we're looking at now is that man and woman and the child that come to the clinic to access the service and that life-saving medication. However, within that, we have a diverse range of clients. We have adolescents, we have students, we have pregnant women, and we have working class. So as you design a health supply chain system, you want to consider the values or the needs of these clients. So what are some of these interests of these clients? So one, we know that the clients value privacy. And secondly, they also want that level of confidentiality. They value their time, as well as, if they can save some money, it's even better for them. So in whatever we are doing as we design the supply chain system, we want to make sure that we tailor the supply chain system to the clients. So just to give an example, under the USAID Discover Health project that I'm working with, it's not only about making these drugs available. You make the drugs available, yes, that's key with supply chain, but then you have to think of how are we going to make sure that these clients can access these commodities in the way they are comfortable. So under the project, we established a men's clinic. So let's look at men for a minute. I'm not putting men on the spot here, but I think studies have shown that some men shun general clinics, and understandably they're busy, but we know that women are busy as well, so they find time to go to the clinics. But what is it about men? So sometimes they just don't want to be around. There's so many women, there's so many children that are at the clinic. So how do we tailor the supply chain system or this service provision that speaks to them? So this men clinic was established and is offered over the weekends. So over the weekends, it's not crowded, there are not so many other people around, and men are not so busy. And we have noted an increase in the uptake of healthcare services and commodities. Thank you.
Great. Thanks so much, Mika. It's really important to consider the needs and wants of clients, not only in delivering services, but also in delivering products. So definitely some important things to keep in mind in terms of the supply chain and how we best serve these clients based on their specific needs. So next, I'd love to go to Laura and have your insights about how we get to that client-centered supply chain, and would be curious about InSupply's experience in terms of supporting Ministry of Health to design and implement client-centered supply chains.
Yeah, that's quite interesting, Carmit, as you ask it, because in order to tailor make services for the client, at InSupply we're using human-centered design, where it's actually the human, the user, the client at the center of everything that we design. So, and they're part of the creating the solution that we have. We have a project in northern Kenya where we used human-centered design to completely redesign SysTalk. SysTalk is a mobile reporting resupply tool for community health volunteers. And you will understand and let's appreciate that community health volunteers are really at the forefront at community level and really last mile to get to the patients who are part of the clients that we're dealing with. And so the resupply tool was redesigned for reporting to ensure that it can be used in remote settings. When we think of nomadic Kenya, northern Kenya, where sometimes literacy is a challenge and the communities will migrate from time to time. So the HCD process led to a client-centered tool that can be used by community health volunteers on any kind of phone, whether it's a smartphone or a USSD option that you can have, you can use it. They're simple icons on paper forms because you cannot really run away from paper. And the app has an audio feature, which then for those who may not be able to interact with it can listen and follow the instructions. And with this tool, then we're able to carry out the resupply rules and ensure that resupply this product for all the patients at the end of the supply chain. So the resupply rules were also adjusted to accommodate the nomadic community health volunteers. So then resupply can happen from other facilities, and quantities are not limited to the traditional system of minimum and maximum levels. In this way, we are placing the client at the center and tailoring all our solutions to ensure that the client has the best access and ultimately serves the patient at the end of the chain.
Great. Thanks so much, Laura, for that example. It's fantastic how you've used human-centered design to adapt not only the tool, the technology, but also the processes that go along with it. And interesting how the approach that you've used, you've served the other clients that Phil mentioned earlier, the community health volunteers that are really at the heart of serving the nomadic populations in northern Kenya with both services and products. And so the approach that you've taken better accommodates their needs to be able to serve these communities with products.
Exactly.
Great. Thanks so much, Laura. Maybe one last question for Phil here. Welcome back, Phil. Phil, we've gotten some great examples of client-centered supply chains from both Laura and Mika. And those are the supply chains of today. Would love to hear your thoughts. Use a crystal ball to think about what are the future. What will the future client-centered supply chains look like, and how do we get there?
So I think I want you to picture, a theater or say Broadway, where you've got actors on the stage. What we're basically saying is we're putting now the client right at the center of that stage, and there's a light that's flashing right on the center, and everyone around them is looking at this the actor right in the middle. So we want to make sure that we hear the actor. We want to make sure that we can see them, and then we need to acknowledge, their performance. The good and the bad, but we need to celebrate the effort. And what that means, in essence, is we're talking about we are empowering, we are now bringing in self-reliance, autonomy, and sustainability, where the focus is on the client. And some of the future elements we need to consider very seriously, obviously, is to do with elements of innovation, private-public partnerships, for example. We need to look at technologies that we need to deploy, like the one Laura just talked about. That's the future, where we need to go as far as possible to the lowest levels in the supply chain. We need to look at upskilling. Obviously, technologies, e-learning, for example. Those are all elements that need to be factored into this equation. And the last thing I want to share is collaboration. There's definitely a need for collaboration, something we call let's call it collaboration, where we need to make sure that there's trust built between the government and the private sector. What you usually get is that there's very little trust between government and the private sector. Some of that is justified, but I think there's need for us to find a common ground between those two actors. So that's the future. It's going to be hard, but definitely there'll obviously be need for that to happen regardless.
Great, thanks so much. And I love that analogy of the client on the stage. And I think to take your analogy further, we're only at the beginning of the play. And I think we had some great examples about the client-centered supply chains of today. And I think you gave us lots of food for thoughts in terms of how innovation, radical collaboration, and other elements can play into further work on creating more client-centered supply chains. So I think that's a great place to end, although I could talk with you all for forever on this topic and others. A huge thanks to all of you for joining me today on this second in the series of Facebook Lives on client-centered supply chains. It's been really exciting to hear your real-world experiences and perspectives about where we are and where we're going. Thanks so much to those of you who joined us live and those who will listen to the recording. And looking forward to seeing you for the next time. Take care, everybody. Bye-bye.
Bye.
Thank you.
Thanks, Carmit.
Bye.